Good morning and welcome to New South Wales Health's COVID-19 update for Thursday the 4th of February 2021. For the 18th day in a row, New South Wales has recorded no new cases of locally acquired COVID-19. 3 new cases were reported in overseas travellers, bringing the total number of cases in New South Wales since the beginning of the pandemic to 4,928. New South Wales Health is treating 50 COVID-19 cases, none of whom is in intensive care. There were 10,551 tests reported to 8 o'clock last night, compared to the previous day's total of 11,816. New South Wales Health has today begun screening passengers arriving on flights from Melbourne following a diagnosis of a positive case of COVID-19 in a hotel quarantine worker in Melbourne late on Wednesday. Passengers will be screened for symptoms of COVID-19 and asked if they have been to any of the venues of concern listed by the Victorian Department of Health and Human Services. If you've been in Melbourne recently, please check the www.dhhs.vic.gov.au website to check whether you have been to any of the venues of concern and continue to monitor the site for updates. New South Wales Health has also been advised that 5 people in New South Wales were staying at a separate quarantine hotel at the same time as a transmission took place between guests. These 5 people have already been contacted and advised to get tested and isolate for 14 days since they were there, regardless of the test results, and to test again at the end of that period. New South Wales Health is closely monitoring the situation in Victoria and will update its health advice accordingly. We will continue to work closely with our colleagues in Victoria and other jurisdictions to ensure the appropriate public health measures are in place to protect the community. These Melbourne cases are a timely reminder that COVID-19 can emerge at any time. Testing is one of our best defences against the virus, as it gives us the best chance of finding new cases early and preventing new chains of transmission in the community. If you have a cold-like symptoms, we urge you to come forward for testing immediately. This is important for everyone in the state, but particularly for residents in southwestern Sydney, as the ongoing sewage surveillance program recently detected traces of virus that causes COVID-19 around the Liverpool catchment area. A small number of recovered cases live in this area, but we are concerned that there may be other undiagnosed active cases in the community. There are more than 350 COVID-19 testing locations across New South Wales, many of which are open 7 days a week. To find your nearest clinic, visit our website or contact your GP. Thanks very much.